Good day and welcome back to the Ace Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, subscribe and share. And please come back for more. See you soon.
Welcome to The Explainer. If you're expecting, you've probably been handed a list of supplements, and let's be honest, it can feel a little overwhelming. So today, we're going to cut right through all that confusion. We'll break down exactly what these routine supplements are, why they're so incredibly important, and how they help build a really healthy foundation for both you and your baby. Let's get into it. This is a question we hear a lot, and it's a big one. It's on a lot of people's minds. If you're trying to eat healthy, are all these extra pills really necessary? Or could they even be harmful? It's a completely valid question, and one we need to answer. And that's exactly what we're here to do. We're going to look at the actual science behind these recommendations to give you a clear, no-nonsense understanding. This is all about giving you the clarity and confidence you need, so let's start by tackling that first big question. So first up, why are supplements even needed in the first place? It turns out that old saying, eating for two, is a little more complicated than it sounds. Think about it this way. Your body has basically turned into a high-performance construction site, and it's building an entire new person from scratch. So your nutritional needs don't just go up a little bit, they absolutely skyrocket. Even the healthiest, most balanced diet can struggle to keep up with that kind of demand. And that's where supplements come in. They're not a replacement for good food. Think of them as a crucial safety net. And the benefits of that safety net? They're huge. We're talking about lowering the risk of really serious birth defects, helping prevent things like anemia, and that crushing fatigue that so many mothers feel, and just building a much stronger foundation of health for both of you. It's really one of the most powerful preventative steps you can take. All right, let's get into the specifics. Now, while there are a lot of different prenatal vitamins out there, there are three that are pretty much universally considered absolutely critical. Let's call them your pregnancy power trio. First up is folic acid. You can think of it as the neural tube architect. It's a B vitamin, and its job is just non-negotiable. It helps form the neural tube, which eventually becomes the baby's brain and spinal cord. But here's the most important part. All of this happens within the first 28 days after conception, often before a person even knows they're pregnant. That timing is everything. So getting enough folic acid is all about prevention. It helps prevent what are called neural tube defects, and these are incredibly serious conditions like spina bifida or anencephaly. This preventative power is exactly why folic acid is a cornerstone of prenatal care everywhere. So what's the magic number? The World Health Organization, or WHO, recommends 0.4 milligrams every single day. And notice the timing here. The recommendation is to start taking it from the time you start trying to conceive. That way, those protective levels are already there right from the very beginning. Next in our power trio is iron, the oxygen delivery service. Iron is what your body needs to make hemoglobin, which is the protein in your red blood cells that carries oxygen all around. During pregnancy, your blood volume increases dramatically, by almost 50%. So your body needs way more iron to get enough oxygen to you and, just as importantly, to your growing baby. And the risks of not having enough iron are significant. For mom, it can lead to anemia and just debilitating fatigue. For the baby, it's linked to a higher risk of premature birth, low birth weight, and it can even lead to complications after delivery. To prevent all that, the WHO recommends a daily dose of 30 to 60 milligrams of what's called elemental iron. That's just the amount of pure iron your body can actually absorb and use. This daily dose helps build up those crucial iron reserves that you'll need for the entire pregnancy. And our final member of the trio is calcium, the bone and teeth scaffolding. Now get this, a baby is born with around 300 bones, and all the calcium needed to build that entire skeleton is pulled directly from the mother. If there isn't enough in her diet, her body will literally take it from her own bones and teeth to give to the baby. It's pretty amazing. So, supplementing with calcium does two vital things at once. First, it gives your baby all the building blocks needed for strong bones and teeth. And second, it protects you, the mother, from losing your own bone density, which can help prevent things like osteoporosis later in life. On top of that, research also shows it helps prevent serious conditions like preeclampsia. Now, you might look at that number and think, whoa, that's a lot. And you're right. This WHO recommendation, 1,500 to 2,000 milligrams a day, is specifically for people in places where getting enough calcium from food is tough. This really highlights an important point. Everyone's needs are a little different, which is exactly why that conversation with your doctor is so important.
Okay, so moving beyond the big three nutrients, routine prenatal care also includes other crucial protections to handle some different kinds of risks.
For instance, in many parts of the world, malaria is a very serious threat. Pregnant women are especially vulnerable to it, so the WHO recommends preventative medicine to protect both mom and baby. And then there's something a bit more universal: routine vaccines. A vaccine like the tetanus toxoid, when given during pregnancy, isn't just for the mother. It allows her to pass protective antibodies directly to her newborn, giving that baby a vital shield against disease right from birth.
Of course, with any medication, there's always the question of side effects, right? This can be a major source of anxiety, so let's just tackle it head on.
Well, the good news is that for most people, any side effects are usually mild and totally manageable. You might experience some nausea, and iron is pretty famous for causing constipation or, well, dark stools, which, by the way, is a normal and harmless sign that your body is absorbing it. But the most important takeaway is right there at the bottom. Don't just suffer through it. Always talk to your healthcare provider. They have plenty of tricks up their sleeve to help you manage these things.
So, after going through all of this, what's the big picture? What's the one thing you should really take away from all this information?
I think this quote really says it all. This isn't about treating an illness, it's all about prevention. It's about giving your body and your baby the absolute best support system and nutritional foundation you can during one of the most critical periods of development.
And that brings us to our final and maybe most important point. We've given you the why behind the science. Your next step is to have the what conversation, as in what's right for your specific pregnancy. That chat with your doctor or midwife is truly the most important one you can have. Thanks for watching.
Please subscribe.